Good evening. Welcome back to Sundays with Sheetal. This is where we discuss little life hacks towards a happier space for each of us, a happier life, a happier us. We're taking baby steps, and today's step is leading us towards reflexology. And with us, we have Dr. Ravneet Grewal. She joined this bandwagon of um, health and alternative therapy much later in life, and it came from a personal experience of pain that she wanted to deal with, knee pain and some body aches, and she delved really deep, and now she's mastered it, and she's worked with some of the best therapists across the world, and she's brought it back to Bangalore, where she has pro reflex centers in a lot of the clubs we all visit, and she's got a beautiful spa on Level Road, um, which she's going to talk to us about. And Ravneet, welcome to Sundays with me, and let's talk a little bit about your journey into reflexology.
Yeah, thank you, Sheetal. It's so nice that you have invited me here. I'm really enjoying it. And reflexology is something, it's a second innings for me. I started to learn massage and reflexology at the age of 52 from ITM school. And that came up from the need when I had a herniated disc and I had an ACL tear in my knee. That's when I went to got myself treated at Chiang Mai, and I felt that this is something that can really help me heal. And when I felt the healing, I started studying for it. So I joined a school named as ITM under the Health Ministry of Thailand and the Ministry of Education of Thailand and under the Chiang Mai University. So we did a 6 months advanced practitioner and a teacher trainings course in advanced reflexology and ancient Nuad therapies and all the spa therapies, of course. Now, when I came back, I had a passion of teaching people. I felt that all the masseurs and masseuses, they could be converted into therapists. And if they learned the proper movements, not just rubbing their hands up and down with oil or cream. So we started training. We trained 64 masseurs and masseuses from natural salons. Mr. Kumara Velu gave me that opportunity. But then I felt that if I become a practitioner, that'll add more value and I could really heal lots of people. So in 2000, my journey, they started from 2015, and 2017, we started practicing. We got one of the, like our clients were amongst the who's and who of Bangalore. And it was very nice to work with them because they were all professionals. We had professional dancers, Vani Ganpati, Satyaraju. We had all the cricketers, Mr. Charu Sharma, Rahul Dravid. We had all corporate heads, MD, CEOs of different companies. So it was like addressing to their pain, ache, and fatigue, why they were having it. And through the movements that we had studied, and so we could apply it to their body. We had Mr. Prakash Padukone.
So you had a 6-month intensive course.
Yes,
which
it was
a residential course.
Yes, it was
you
a 9.
And you did it there.
Yes, it was a 9 to 5 course, 5 days a week. But I didn't leave the weekends unattended to. On the weekends, I learned a lot of short courses in spa therapies because there are many. I wanted to master all movements.
Right.
That
so tell me, now when you're training, how long does it take to train a therapist?
Yes, it takes around 3 months for a therapist to master the skills. You know, the way we want a movement, so that the movement is like as smooth. I mean, silky smooth, I would call it. But what we do is that when we are teaching them, say if I teach them foot reflexology, it takes at least a week for them to understand it. Because in a foot reflexology, there are 72 movements that go from your toes to the knees. And in foot reflexology, what I say is that it gives you a diagnostic overview of what is happening inside your body. Right. If the therapist is trained very well, he or she can actually identify the body part or organ which has a tension level in the body. So that is how our hands can feel it. We may not know what is the intensity of the problem,
So
but
for
we,
so I'm just going to cut you here. I so to understand a therapist will have to understand a little bit of anatomy, right?
yes. So when we teach them, with every movement, we teach them an anatomy and physiology. We teach them what their body is. Here, a lot of people ask me that what is the educational level that you require for training for becoming a therapist. So we tell them they just need warm hands and warm hearts, because we teach them with diagrams. We make them understand it. So they don't need to really read and write. If somebody, I have a lot of therapists who are graduates also. So it's very easy for me to make them understand. But even the ones who've not had a higher education and, at school level, they've opted to pick this up as a profession. So we teach them the body parts, because everybody can understand body
Right.
parts now.
Now tell me something. What Let's get down to the basics now. What is reflexology? Because there's a lot of therapies that are there's Mamra where they again it's a pressure point thing. Uh, there are so many different therapies today, and also in reflexology there is I've gone to I love a foot massage. I'm crazy about reflexology because I think that's really helpful for me. It works very well for me, but I've gone to different places which have 72 strokes, have 32 strokes, have this stroke, have that strokes. What is the difference between these strokes, and when do you know what you need to employ? Like Footworks,
Now,
if you remember, there was a place called Footworks. They had a
yes,
certain number of strokes.
yes.
Kenko had its own different number of strokes and different technique. Now if reflexology is one, what are these different techniques? What is this?
Now, see, reflexology is an ancient science. It was developed by the Chinese 4,000 years ago. Then, around 2,500 years ago, it was picked up by physician Sakara of Egypt. And then in the 1930s, it was picked up by a physiotherapist and by a pathologist, Dr. Fitzgerald, who's known as the father of reflexology, and his student, Dr. Eunice Ingham. When they picked it up, they added a scientific aspect to it. So they developed it first as a zone therapy. They developed like 10 zones in a foot. Now, say if I have to put this as my foot, so later it came up to that a foot has 4 zones. Every organ, every part of your foot is associated with the organ in your body. The foot can be divided into 4 zones practically. So the toes of your foot, they represent the head region. The base of every toe, if you put it here, this will be the neck region. Then the ball of the foot, it represents your thoracic region, right from your trapezius muscles to your lungs to your shoulders. Then the center part of your foot, that represents all the internal organs of your body, and which is like your stomach, your pancreas, your duodenum, your urinary bladder, the uterus. On the right side, you'll have your liver. On the left side, you'll have your heart. And then you have your ascending and descending colon over here. And the heel of the foot, that represents all the reproductive organs and all the body parts that are situated in your pelvic region. Now, we blindly follow the methodology that our school has taught us, because they feel that reflexology should not only be as a relaxing or a rejuvenating thing. It ought to be, but if you can take it wherein you are stimulating 7,200 nerve endings, 19 muscles, 107 ligaments, 26 bones, then you are like completing a treatment for a client of yours or an individual when you do that whole process. And when you are say, and like we never call it foot massage because it's much, much more than that.
Yes.
This would take 1 hour, half an hour of leg. Now, say somebody, as you said, that 36 movements, no? Those 36 movements, if you are doing, like the 1 hour would have, you would be using your hands and you would be using a wooden stick. So say if there are 36 movements in the hand, there are equal movements in the stick, which you use with the stick also to complete that set of movements. When we use 36 movements, then we are using practically only our hands and we are concentrating on the foot itself. Yeah.
Okay.
So the underlying science is there to stimulate the nerve endings of all your organs or body part from the foot or the leg itself. Like why we say the leg, because the calf muscle, it's known as the second heart. So when you are doing the calf, and there even like the leg, we divide it into three parts. We do the outer lines first, then we are doing like the trigger points on the center, like there's a point on the foot, from the center of the foot, you're going to the knee. So you're moving along the bone over there. So those are all trigger points which are there for your body. Yeah.
Okay. So now tell me, is reflexology indicative? You said it's indicative of problems if you have any. So the more the pain, the more the issue there?
No, see, there will be a pain. It will be a momentary pain, and it would necessarily sometimes not be a pain, but your hands can feel the tension in the body, in that particular organ. And that organ or body part would have a pinpoint. It would not be like, it would not be a whole part, but your hands have to very indicatively understand what is the organ. Like I have helped 3 women detect one of the lady with a breast cancer at the stage 1 of stage 1, one with the uterine cancer again with the stage 1 of stage 1. So for us, the reflexology, like we treat a lot of cancer patients as well, even who are in a very advanced stage. We do reflexology for a prenatal massage also. Now we are tied up with a gentle birthing system, Dr. Namrata, wherein we are doing reflexology for all the mothers to be. And there, according to Dr. Geeta Mota, there we every week, like there are some organs that need to be stimulated. So our movements out of that are then, like what do we say, focused towards those organs
Right.
or body parts. Yeah.
So this is indicative of a problem, but is it
Yeah.
curative?
Yeah. See, cure is a very strong word that we could use, but yes, it is. Like, say, suppose somebody, for example, has a pain on the Achilles tendon and the heel, here. So we could immediately judge that a person has high uric acid. So when they have high uric acid, I mean, our fingers can detect it that they have high uric acid. So when we tell them, yes, you please go and get it checked. Then we build a treatment program for them, that this is the number of times that you should come to us, like once a week or twice a week. And then it's not only reflexology. First, we do reflexology to understand the problem, and then later we take them into other forms of therapy, like the ancient Nuad Buran. Ancient is as an ancient.
What does
Nuad means
this one? I read about it on your profile, but what is the difference between this and reflexology? What is it? How do you pronounce it?
it's known as ancient Nuad Buran. So
Okay.
ancient is as in ancient, Nuad means to knead, and Buran is a study. So it's an ancient art of kneading. Because when we do this, that is a dry therapy, which is a clothes-on therapy. So you are pressing and then you are doing an assisted passive stretching. So there we work on all the meridians. Like in Ayurvedic, you can call them marma. In Chinese, they call it meridians. In Thai, they call it seine lines. So those seine lines are not visible lines, but they are like virtual lines. But the movements that we do, then we are stimulating all the organs and the body parts and the blood flow and the lymph flow uh, in those movements. Yeah. Like, and in reflexology, like the way we do it, we lay a lot of emphasis on the lymph flow. Because like the lymph, as I would say, is the byproduct of your blood, and it only moves in an upward direction. So when your pure blood comes to the feet, there is an impure blood which is flowing back upwards. Now with the impure blood, there is a whitish liquid which is known as the lymph, which flows. Now this lymph, it stores the bacteria and the viruses, friendly or unfriendly. So this we like have it in the behind our the first lymph nodes would be on the toes, like we have, well, this is our foot, you can see. So we have them on the toes over here, just the webbing of the toes. We'll have the lymph nodes. Then we'll have the lymph nodes behind our knees and in the groin area, your spleen. Then, like in the underarms, under the collarbone, above the collarbone, and the network flows in your legs, in the arms, behind your ears. So all the movements that we do in any therapy, they are associated with stimulating the lymph in the body, so building an immunity in the body.
This would be like a lymph drainage massage.
See, it's a lymph drainage. There, then we have a specific lymph drainage, which we call it like a facial lymphatic drainage. That we do it like from your clavicle to the nape of the neck. So that is the facial lymphatic drainage. But all the tail, even if we are doing a reflexology, so we would work on the lymph nodes behind the knee. We would work on the and in between your toes. We would concentrate on the lymph node while doing the reflexology therapy. Because when there are 72 movements to be done, and every movement has a scientific approach to it, like even when they are moving, so it would not be, say, like, this is my leg, this is my leg, we have a line here, we have a line here, and this is the center. Now, if it's here, it's your ankles are here. So along the ankles, like the fingers would be placed just in place, like to take them upward like that. It's not that you can place it here or you can place it here. You have to place it right at that spot. So that is what maybe we are different, or we just try to follow.
So
We
tell me
totally.
something. I always
Yes.
have this fear that when people are thin and you can feel the bone neatly and clearly, it's easier for the therapist. But when you have a lot of fat around you, it's difficult to find the right spot. Is it possible for reflexology to go wrong?
Actually, if the therapist has learned it very well and they follow it blindly the way their teacher has taught him, they cannot go wrong. They cannot. They will never.
Irrespective of, irrespective of size and shape
Fall.
and any.
Yes, because see, we have children who are as young as 10 years old, because we work with a lot of competitive sports. So we have children as young as 10 years old to clients who are 98, 99 years old. So you cannot go wrong, because when we teach them where to place the finger and how to place it and why they are placing it. It's not just telling them that do it here. No, it's why you are doing it. So at times it's difficult for some of them to learn in the beginning, but if they learn it, then they are masters.
But if you haven't mastered it, you can damage something, you can cause harm.
See, in all our Pro Reflex and in our urban unwind outlets, we do not allow a therapist to touch a client till he or she has not mastered the science. Like even if
So
it,
that
yeah,
is that is for people trained by you. What I'm
yes,
saying is, I remember in Singapore, I went to one of these reflexology. They're all over the place. They're mushrooming.
yes.
I came back with a very bad pain that lasted, a ligament pain that lasted me 6 months.
Yes, what happens is then some of the people just learn it, they say from their parents, or they've not learned it the right way. So
Mm.
here, what is that training and learning it the right way is very, very important. Very important. So people, anybody who practices a science, it's like being a surgeon or a doctor, wherein you're not doing the surgery, but your hands are working on the client. So your hands are your tools. The
Mm.
biggest tool that we have is our hands. We even have a wooden stick. I'll show it to you. We have a wooden stick which we use. Again, we are using with our hands. And like, see, even the wooden stick. So I normally all the therapists, they are from Northeast. So even when I teach them how to hold a stick, I give them an example because they normally peel their potatoes or something in this. This is the way they hold it. So it's easier for us to teach them how to hold the stick. So there's a way to hold the stick. You cannot hold it like this and do it. The pressure. If you hold it like this, that is when you'll be able to apply the correct pressure. And it will never be a piercing pressure. It will be like just correct pressure. Yeah. Yeah.
Right. So is there a concept of too much pressure?
No. See, many times when clients come, like we have to tell them that please do not tell the therapist what to do. A client which we are giving to you, the therapist, a good therapist can actually judge the client's body, how much pressure. You don't have to put like a pressure. You don't have to.
I'm always asked, is this okay or harder? And I'm like, karo harder. So
No, no. What happens is, I tell my therapist, you never ask the client what pressure do you need. That is my first teaching to them.
Yeah.
Because I never ask the client how much pressure. I have till date, I have like over 4,200 clients. I have never ever asked. Because if your hands cannot judge how much pressure the client needs, then you are not trained well. And you've not
Correct.
practiced well.
I agree with you on that because
And even
I always get asked, and
yeah,
my
even
threshold
when
for pressure is more than other people, right? So, but that may not be a
see in
good
that
thing for me.
no, what have that see when you like a pressure of that kind, then I teach them that be there. We have one quote that when a client wants a pressure, you be there in that spot. See, normally what they do is, like suppose this is there, they'll put oil and they'll just like move it like that. You know, just you're moving it. So instead of just moving it, if you are putting your fingers here, you're digging in your fingers here, and then you are moving. So you are automatically applying a pressure to that area or to that body part without even the client knowing. But if I'm
Yeah.
doing this, you will automatically ask for more pressure. But if they do it
Got
the correct way, you will never ever ask the pressure because you don't have to pierce into the bones. Your position and even your Sheetal,
Yeah.
see, it's we had one level wherein when they had taught us the massages, let's say after 3 levels, the fourth level was just to show us how we put our hands or a finger, like a thumb. Say if it's can have the tree.
Sucharitra is asking if we are going to do some practical demonstration. Yes, we are.
Yeah.
Ravneet is going to show us some points we can practice at home.
Well, that I'll do it on Balanchai. Now, see, suppose here, now one is that you are placing a thumb like this. Normally, what I've seen is in all the spa therapists, when I get new recruits, they are attuned to putting their thumb like that. It takes me a week just to tell them that put your thumb like this. You do not need
Yeah.
to put it like that. When they put it like that, their hand starts hurting after 1 or 2 therapies. They can't do more because they've exerted their whole hand. Instead, if you are putting it like this, you are actually putting in the right pressure and the client feels nice about it also. No? So that is the whole idea behind. So placing the
Right.
hands, placing the movement, where, what, how is what is we would say in our school they would call it authentic reflexology. So yeah,
Right.
and the
Yeah.
yeah.
So I've had a lot of places do dry with the powder and some do with creams and oils. How does this work? What is the
See,
actual way of doing it?
okay. See, there's no actual way. Powder is a medium, oil is a medium, and cream is a medium. So foot, we always do it with cream, but what we do is in our cream, we mix almond oil in it. We beat it like an egg. I mean, I tell them beat it as fluffy as an egg, and then we do it because the cream would give in, because your foot is hard. You know, the soles are harder than the other part. So the foot, the cream actually gives it a better way to move. Yeah, and oil on the foot would not give that good an experience how a cream would give. And powder again, because some people are allergic to a cream or allergic to an oil, so they prefer to um, use powder.
Okay.
But oil is definitely, if you're doing the full body, then no comparison to oil. And here, like I would, as I would just like to point out, a lot of people feel that if we are having a pain, should we put a pain oil on that area? No, it's not needed. You can use an olive oil. We normally use olive oil. There are a lot of people who use, I have a lot of clients who use mustard oil. So oil is just a medium. Your hands or the way you move is what will remove the pain,
Right.
not pain oil. A pain oil will be good for you at home if you want a momentary relief. Say you have a back pain or a knee pain or a shoulder or something, you can immediately put it and you can rub it with your own hands. So it would
Right.
give you herbs over there, would give you a relief. Yes.
So all these therapies are basically working on your energy blocks, right? Like a
Yes.
pranic healing, like all of these are working on different meridians, different zones, whatever you want to call them, but basically the life energy and the blocks, right?
Yes, yes. See, what happens is it's the energy, even of the, I would say, the energy of the receiver and the giver. The
Mm.
receiver is the client, the giver is the therapist. So even if their energies don't meet up, like say my therapist doesn't buy like an XYZ client or vice versa. That client doesn't like the therapist. So they will automatically, stiffen their body or not have that feeling. So the therapist may do his or her best, but the client would not get that proper feeling. So that's our first training before we start making them understand what movements are. The first training we do it is in soft skills, how they need to accept the client irrespective of age or
And
uh,
it's so important.
appearance or anything. Nothing. It's the body. It's the body in front of you. You have to do it on a body. So your thing, and I always teach them there, whom do you love the most? So, just visualize the person whom you love the most, think the client is that, and then you let your fingers move on
Nice.
the client hands. Yeah, yeah. So then that really gives a mesmerizing feel.
No, that's very important, I feel, to connect with, you know, the person you're doing it with. Very
It's
important.
about,
I
yeah,
think that's why we all have our favorite hairdresser, our favorite therapist, our favorite masseuse. I think
yeah.
that's the connect that we have. It's not just their technique; it's that vibe that you get from that person.
Yes, absolutely. Just there, you coming in, lying down, and they using a hot towel to wipe your feet or asking you, how are you? Or asking a glass of water or a hot cup of tea. And, that immediately sets down the mood for the person for the receiver and the giver
You
also.
know, it's surprising you are taking it to this level, and you've learned it from Thailand, where it's a business where they don't care. Actually, they don't. It's like, okay, next, okay, next. They don't have that connect. The masseurs there, they don't have
Mm.
that connect with people. So it's really surprising you've learned it over there, but you have added this really nice human dimension to it. It's really nice. It's
Yeah, for me, it's a professional passion. Like,
yeah, yeah.
I just feel that a client should go. I tell my therapist before the client gets up from the chair or the bed, he should have thought of three people whom he is going to introduce you
Absolutely.
to. That's,
Yeah.
yes.
I have a very interesting question here from somebody who is a cancer patient, and
Mhm.
they want to know if they can practice it on themselves.
See, if they want to do that, then they need to learn it first.
And is there
Like they need,
anybody in Delhi you would recommend?
sorry?
This person is in Delhi.
Okay.
He wants
So,
to know if there's anybody in Delhi you can recommend.
Delhi, I have not taught anyone. But we can always, even DIY, I don't know how much they can do because they would not know how much of pressure to apply or something. But we can always, suggest them some, she can always get in touch with me. I can always do an online something with her and suggest her some things that she can do, which would give her a relief. Yeah, which would definitely give her.
We'll share your
Because I
contact.
work,
We'll share your contact details at the end of the session.
sure.
And I hope this helps you uh, in Delhi. So I'm also going to ask you, Ravneet,
Yes.
um, how long does it take to see any effect, positive effect from reflexology? It
Okay.
can't be a one-time session if you have a chronic thing, right?
Yeah. See, in the one-time session, what happens is if it's done by a master, firstly, if somebody has a chronic problem, we only give the client to a therapist who's mastered it, who's a senior therapist. We do not give it to somebody who's a beginner or something. So, in one session, the person can actually identify that I am feeling much, much better. Like you say, we had a marathon runner who runs 8 kilometers a day. So for the very first session, when we did it for him, the very first session, and I remember we did it in Bangalore Club in the badminton court when we'd gone to give our presentation as to what we are and how we do it. So in the very first session, next day morning, he could put it on to the group that my pain, heel pain is much lesser after running for 8 kilometers. So the very first session definitely gives a remarkable result, but to feel totally free out of it, like you feel the pain has totally gone or you're feeling subsequently much, much better, you need a couple of sessions, and we can identify, like we can tell the client how many sessions they need. So if it's something very chronic, then me and my son, we do it the first session. We identify what the problem is, and then we put it on to our senior therapists, no? Or maybe a couple of sessions also we do at times, and then we put it on to our therapists, wherein we build a treatment program for them. And it's not only the reflexology. I lay a lot of emphasis on exercises. So depending on their flexibility or their size of the body and their body acumen, we design exercises for them, very simple ones, which they can do in their day-to-day living. We even give them suggestive measures for what they should eat, what they should not eat, and why they should not eat it. Because I have graduated in home science from an agricultural university. So I bring that also into play, and say somebody has high uric acid, or we identify somebody has a cancer problem, or somebody's heart is not working well. So we give them suggestive measures that how the herbs and spices in their own kitchen can help them heal much better. Yes, yeah. So developing more on a well-being.
I've been doing a series of different remedies over the last few weeks. When do I know whether I need pranic? When do I know whether I need reflexology? When do I know if I need some other, you know, there are so many of them. How do I know which one I need when?
Yeah, see, reflexology is something which is a physical treatment. It's a physical treatment which you are receiving from someone else, but that physical treatment is helping you with the functioning capacity of your organs and body parts directly. So it starts giving you, like, I don't condemn pranic healing because it's an energy level and feel it, but maybe I am more into physical healing. So I feel that physical healing gives you like an instant result. And pranic healing,
Right.
of course, for your soul and, for you to feel much more peaceful. I get Reiki sessions done from my friends at times when I'm feeling very down. I just tell them, do a distant Reiki session. But reflexology is something which is one-on-one. It's very personal. You feel it immediately. Then the best part in this is that when you go back home in the night, you sleep very well. So the moment you've slept very well that day and you wake up in the morning, automatically half of your problems are gone. You have a much more clarity as to what I should do next.
So I remember being told at a couple of reflexology places, and I've gone everywhere that I can think of because I love it. That after you
Please
finish a
come to
session,
us. Yes.
I am new there. This pandemic it's been a year and a half that nobody touched my foot or my hand, and it's all crying for some attention. But I'll be there soon for sure because you have sold me with your with just your the way you're humanizing the whole thing for me. What I've been told is after you finish a session, you should have a lot of water, and that you should go and urinate as much as you can to remove the toxins because they're on the surface of coming off because of the reflexology. Is that true, or is that just
No, 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 it is true. It's not only true for the receiver, but even for the giver.
hmm,
After every session, I tell them to have a glass of water. I have a glass of water on my table, always put. And the first thing after a session is that we go and use the uh, loo, to drain us out. Because even when you are doing it, the points which are there on your hands, so you are pressing the person. So all the nerve endings of different organs on your hands are also getting pressed along. So yes, you feel the need. And if you have water, after that you hydrate yourself, it's excellent. We also tell people to have green teas. We make like a lot of spice green teas also with all your
Yeah.
regular spices just brewed in hot water, which really help out.
Okay, lovely. So I think we are getting a lot of inquiry on what can we do on our own. So maybe we can discuss three or four points that we're living in a time of stress. We are living in a time of anxiety. We're all just so trigger happy right now to think the worst. What
Yes.
what are the points that you can tell us that can be done easily without damaging ourselves at home? uh,
Okay.
Simple things. We don't want anything complicated where they can mess it up for themselves. For that, they need to come to you. Those in Bangalore are lucky enough they can come to you. But maybe a few points that I have a headache. What's the
Yeah.
point I can press to release that? Small things that are actually a pain in the neck when we're suffering it, but which can be dealt with by ourselves. Like if I have a cervical pain, maybe if there's a point. If I'm stressed, maybe something for that. Simple things. What are the simple things we can do at home by pressing certain points?
Okay. Now, see, firstly, what happens is that pressing one point would never help.
Hmm.
So when you are pressing any, like say you have a headache, like headache is something, or we are just stressed about something and we just want to give it like a momentary relief. You have to understand that the headache, first just, I would always say close your eyes and think. Headache could be that you have an indigestion problem. Maybe you've eaten too heavy. So just identify why are you getting the headache for a minute. Now, say if you're getting a headache, you're working on your mobile or your laptop for a very, very long time, which most of us are doing, then what you could do is, like a very uh, simple thing is, yeah, now see here, now here when we, our ears, you see, you can, so here, your movement will be this, like for your hands. So it's your thumbs and your fingertips only. You're not using the whole part. It's just your thumb and the fingertips. So the
Hmm.
words are here. You are
Hmm.
just where your, like this is your earlobe, just behind
Yeah.
your ears. You can very nicely hold the area. First, dig your fingers there, very nicely hold the areas, and then you move it and you just bring it like here. This you can do it 3 to 4 times,
So
from
you're
here.
basically following the shape of your skull.
Yes, absolutely, absolutely.
O-
And
Okay.
why you're following it is that here you have lymph nodes. So
Hmm.
you're basically letting the lymph flow. Then you want to be more, if we have under just where your skull is, you have a, like if you will touch it here, you have a in depth here. So this
Yes.
is lymph node. So with your finger or with your thumb, whatever is comfortable, you just place it there and find the right place with your own hands. And
That's
then
the
you just,
vertical dip. That's the vertical dip in your nape, right? Which touches
yes,
your skull.
yes, absolutely. So
Yeah.
you just place your finger there. Index finger is the best over here. So you can just place your finger there and you just put it there and you nicely rotate it in a circular manner. And at that time, don't have an expectation of miraculous results, but just work on that area. Close your eyes and you just feel that, yes, I'm making it happen. Now you've done it in the
Which finger
center.
are you doing it with, Ravneet?
It is index.
Index
So
finger.
index
Okay.
finger, yes,
Because
you can do it here.
that has the least strength, right?
Yes, it has.
Finger has the least
Like,
strength. Yeah.
so yes. So you just put it here. It's not a piercing thing,
Hmm.
but it's a thing that you can feel it yourself. Then over here, if you go along, like it's here, you can see a half an inch away, exactly half an inch away in the straight line with your thumb. Like with your thumb, you will place it just below the skull, just below the skull.
Yeah.
Let your thumb inside, and then your hands, like the fingers are on the head. So you're not pressing the fingers, but you're pressing the
Only the
thumb. So
thumb.
yeah, how the motorized movement, you press the gear lever. So you're just pressing and motorbike movement. So you're pressing the gear lever upwards, like that.
Okay.
This here, fine.
All this is
And
for
yeah, this is very good for a headache, instant relief. And what you do is when you do this, then you can't just stop here. Because if you see where this has gone, then your neck
yeah.
is here and your trapezius muscles are here. So just with your fingers here, nicely, just move on the trapezius muscle towards inside. Just like this, like you're moving towards inside, like towards your
Right.
plan. Okay? And here, when you like your temple area is the liver area. So when you come here again with your fingertips, you just keep it here and you place it first. First, find a place, where your fingers, you feel, yes, now my fingers have found the right place and they are dug in, not up, not down, not here. And if you want to be more precise, like where your eyebrow is, just like just along the eyebrow, just above the eyebrow here is where the actual spot is, like that way. And just put it here, and you can do it like this.
Again, there's a slight dip there, right?
Yeah, there's a slight dip.
Yeah.
So if you put it over here, then it just fits in very well. Just fits in very well over there, like that, like that. And after that, like with your ring finger and your thumb, like in between the eyebrows are there,
Yeah.
then your eyeballs are here. If you just place it there, again you'll find the dip and there is a point.
Yeah.
So you first place your ring finger and the thumb over there, and then you push it upwards. Like we call it the motorbike up movement. Like this is the gear lever of a motorbike or a scooter, and you do it like that, not push it up. So it's you place it here first, and then you're pushing it upwards.
Ladies, please don't try this with long nails.
Yeah, yeah. I didn't know. We have to, yeah, yeah. So right, Sheetal, yeah. So here, just put it there and, press it up.
So I
And
find that
along the ears. See, because you have lymph nodes here and behind the ears. So very simple movement. With your index finger and the middle finger, just place it here and go up, go down.
can you show us a side profile, please?
Yeah. So just go up and down. Up,
Lovely.
down. So these will like say. And of course, if you want to see it on your foot over here. Now on the foot, what will happen is
So I find that dip in this base of the neck also gives me a lot of relief from just stress. Not just a headache, even when I'm just stressed out, just pressing that part at the dip of the nape, which touches the skull, that really releases a lot of stress also for me.
yes, yes, it does. Sorry, I think I've lost you.
I
Can
think
you?
the video is off.
Yes, yes, yes. One second. Basket. The basket here. That's why I told you to. One second.
So Ravneet, are the points identical on our hands and our legs?
Yes. So what we do, I'll show it to you on the foot.
Okay.
So of course, here I have a very tall to wipe the feet. So wipe my feet very, very well. So now what I was showing you earlier, there are 4 zones in the foot. You have your toes, which are connected to the head region. Then you have your ball of the foot, which is connected to your trapezius muscles, to your lungs, to your thyroid gland. Then this region is connected to your stomach, to the pancreas, to the duodenum, to your uterus, to the urinary bladder. this side, like this is my right foot, so my liver is here, the ascending, descending column. And in the heel is all your reproductive organs, the body parts in your pelvic region. The tip of the heel would be for the knee pin. Now I'll show you
The tip of the heel is for the knee pain.
knee pin. Yeah, yes.
Oh, okay.
So what you do is that you can just cream your foot very well. I'll show you 5-6 movements which would really help everyone. So the first movement is that you keep, this is your heel, just above your heel. You place your thumbs in the center over there, dig them first. You move them in an upward direction towards the toes, just in a straight line. Like your pressure, if you've dug your fingers in the beginning, then pressure will stay the same. Now, when you do this, what will happen is this region is your intestines. You're moving from your intestines. Then here is your adrenal, your kidneys. Just above your kidneys is your adrenal gland. Then here is your solar plexus. Then your lungs. Then here your eyes, nose, throat, teeth all come on the toes over here. You have basically say touched upon your digestive system, your this all your kidneys and all that, touched upon that excretory system. Then here you've touched upon the lungs, which are to be very, very important. So you touch upon here and then you've gone to the toes. This is one movement. The second movement is that you can move in a zigzag manner. So you place your thumbs and then you go zigzag manner to work from the in to the out of the foot. Now, when you can go right up to the ball of the foot, like over the ball. So you're touching upon each and every organ over here. Now, when you've done this, I'll tell you what we've touched upon. So you can move it in a slow. You don't need to go very fast. Just be there. So you're actually like how Navita once said, like she was thanking every organ. So here, when you're putting it, you're actually touching upon every organ, and indirectly you're actually thinking of that organ without even realizing it. So here, when we are doing it in the zigzag manner, we are moving from our kidney uterus to our urinary bladder. Here is your colon. You're moving up to your pancreas, to your duodenum, to your stomach, to your thyroid point, here to your trapezius muscles, to your ears, then the lungs in the center, then the ball of the foot here is your shoulders. And then another movement is you just make a fist like this, a very loose fist. You again place it here. It doesn't have to be a piercing pain here. Rather, you are using this part of your hand. So you just put it here and you slide it down nicely. So right from your lungs and you've brought in all the oxygenation towards the lower part of your body, like that. No?
So direction is very important in all of this, right?
Very, very, very important.
Yes. So now we are moving oxygen downwards towards our
lower body. No? So actually, when we are moving the oxygen downwards, we are even making the blood flow better.
Right.
Because the oxygenation will be carried in through the blood to our body. So you are improving the blood circulation. And then over here, out of these 4 movements, the last movement is you make a C on the ball of the foot. Now, C on the ball of the foot, you are moving from here, which is like your trapezius muscles, to your shoulder blade. So you are working like on the thoracic region. So here again, this is the thing. You keep it here. Your thumb is supporting the outer side of the foot, and you place it here. And in the form of a C, you are moving like that. All these movements, you can do them 3 times each.
Can you do that again, please? The C one?
Yes. The C is like this is your foot. So here is your trapezius muscle here, and the ears here. So when we say ears, like we have our lymph nodes over here and the trapezius muscle. So you place your ear, and you nicely just place it here. Let your thumb be on the side of the toe, like the big toe is there. In the same line, your thumb is here, not pressing hard, but just placing there for a support. And then you form it in a C manner. Just form it as a C. So on the ball of the foot, if I would just tell you with one finger, so you are starting from here and you are going right on the ball of the foot in a C manner.
And how many times should we do this, Ravneet?
Do every movement 3 times.
And this can be done every day, right?
It can be done even when you are like
all your organs a massage.
Yes, even if you like, say, make it a routine when we are cleaning our feet and all that, morning or night, and you just do them in a rhythmic way, it gives you a relief also. Plus, your tiredness goes away. There's a meaning to that movement.
So and this is the right foot. What about if you're doing the left foot?
There, any foot.
The directions and everything will be the same?
Everything will be the same. Okay. Like it means that in the left foot, if you're doing it, everything else would stay the same.
Except
but if you are doing it, your C will be formed.
Yeah.
Like your heart point is here. There was the point. Here is your heart point. So you are starting from your heart and going to the shoulder. Oh. And here I have to point out to everybody, all of us, like we have your backaches and now with more sitting hours and the back sort of increased more. So like these are your ankles, this is the heel. Now your entire, say the pelvic region is situated here. So the best way to move is that on your ankles, around your ankles, just find the groove over there, like the pit over there, where the in-depth is there. Just with your thumb, you can go around the ankle nicely. On around the ankle, you have covered all your points, which are all your organs and the body parts, which are in your pelvic region over here. And it's a very nice, soothing feeling when you're doing around the ankles this side, and you can do it on the other side also. Like other side also, you can nicely just do it around the ankles like that.
So here we don't have to worry about clockwise, anti-clockwise, right?
Oh, it is clockwise.
Okay.
It is clockwise.
A lot of us have flat feet.
Yeah.
A lot of us have flat feet. That pain is terrible at that base of the foot.
Yeah. So for flat feet, what we can do is a great question, Sheetal. Yeah. So for flat feet, now see, this is your spine. Like the central parts are all which are indicative of your organ. The sides of the foot are which are associated with your spine. So for that, what you do is you can just place, again, this way is how you place your hand is, and from top you just move along the line. So you're moving on the spine of the foot.
Nice.
On the spine of your, on the foot, so spine region, we are moving on the spine region from the foot. Nicely taken down.
We have 2 questions here. One is on a self-healing session before going to sleep for good sleep.
Yeah.
And another one is for gas.
Yeah. If you do all these 6 movements that I have shown you on a regular basis, you will get very good sleep. And for a good sleep, you could add one more movement. Say on your hands are here. You can just with the hands, just caress your hands in an upward movement like that. Because what happens is, whether it's the top of the hand or the top of the foot, whether it's the top of the hand or the top of the foot, it is associated with the circulatory system of the body. So you can take it like that. You can do it with the fingers also, or you can do it like that with the thing. So there's a little pressure, so it gives an excellent sleep. Excellent sleep. And just working on the top of your feet.
So this is any cream and oil, right?
Yeah, you use a cream. Cream will be much better because cream is more smoother. It's much more easier to use a cream. Oil, but then it's a personal choice.
Right.
It's just a medium that you use.
And what about if you're really suffering from a very bad gas issue?
Gas is usually when we are moving here, when we are moving with the thumb, like from the center of the heel
Yeah,
and
you're working
going
your intestine.
upward.
Yeah.
So we are actually working on your intestines, adrenal gland, all that we are working in a straight line of the solar plexus. And when you are going zigzag also,
Mm.
you are actually working on the stomach region and all. So if you do these two movements on a regular basis, it will help you with your gastric problems. And of course, one they can always do a Vajrasana also, like it
Yeah.
really.
Yes. Wow, that's a lot of learning. Thank you so much, Ravneet, for your generosity. Um,
Yeah.
I'm definitely going to try that sleep one on my mom, who always complains she's not getting good sleep. We've
Yeah.
tried everything under the sun, but not this one. So I'm going to try this on her tonight. And
Sure.
I'm definitely going to go back to this video. Guys, the video is available on Zaivic, the Zaivic page in Facebook, the live video. So that's going to be there forever. So you can have a look at it and make notes of what you need to do, or re-look at what Ravneet has taught. And better yet, go and visit one of her centers. Tell us a little bit about your spa in Lavelle Road, Ravneet.
See, Lavelle Road, we just have it opposite the Soda Opener Wala and the Beer Club. Now we named it the Urban Unwind. And we named it that because today, like all of us are living in urban spaces and we are really stressed out. So this is a nice space wherein they can come and get all the different kinds of therapies. We have 13 different kinds of therapies that we give over here. Of course, if somebody is chronic, then we start with the reflexology. But if somebody is identifying, oh, I want a full body, then we use our signature deep tissue therapy, which is for 90 minutes. I always recommend that. There are four therapies that I really recommend, and if somebody does those four, in the time span that they feel comfortable with, they are done. I mean, their body is perfectly fit and fine. One is, of course, the foot reflexology. Then we have the deep tissue and the sports rehab. It's not painful, but there are like 54 movements which go into it. So they are touching upon each and every, say, centimeter of your body, right from the toes to the nape of the neck. Of course, we touch upon some points of the head and the face also. Then we have the ancient Nuad, which is the pressing and stretching. And then we have the facial lymphatic drainage, which is one of my favorites. So we work
The
from
what?
your clavicle, we move to the trapezius muscles, to the neck, to the head, to the face. And later then we drain the lymph from your SCM muscle and work on the shoulders. Now, what happens in the lymph is that how you have reflex points in the soles of the feet, same way every organ in your body has an area allocated on your face. If I were to tell you that the jawline of your body represents the pelvic area, maybe you're aware, maybe you're not aware. So even when we are like, this is how I would say like the pranic healing, or a healing process is associated with the way we do our therapies. Now, when we are moving on the pelvic, I mean, on the jawline, and these therapists, they are trained and know what they are doing. So they automatically work on that area. They are moving like this, so they know that yes, they are working on the pelvic region of the body, like that. And then, like along here, you have your heart here, you have your heart here. Here's your colon, your kidneys, urinary bladder. Like your kidneys are here above the eyes and below the eyes. So a lot of movements you can just have even when you're applying a cream to your face in the morning or at night. You can again do these movements in a little bit of a, say, a rhythmic and a more purposeful manner. So you can have your fingers like this and play like right, and then your shoulders should be straight. Spread your shoulders as an eagle. Place your fingers one above the eyebrow and one just below the eyes, and you can bring them like this outwards. So you worked like on your kidneys, your urinary bladder, very, very well. To make the face brighten a bit more, you can do like this and this. Here, so you're working on your quality. Many people, if they have a digestive problem, and they need to understand, first they need to understand why they are doing the movement. The moment they know why they are doing the movement, then they use it more appropriately. Like they can just, here is your quality. So if you just put your fingers here and the movement like that, you're of course brightening up that area because you're increasing the blood flow. Even going for a party and you do this and that, your face would really shine and be bright. But then at the same time, you have stimulated the colon area, the digestive area.
Wow.
Brighter.
Okay.
Yeah.
I didn't know this was the pelvic area and all of that. I just
Yeah.
thought we do this because our lymph glands are here. I knew when you have a sinus, you have to do this because it drains the sinuses.
Yes.
Wow. Okay.
Yeah. So like the
Basically,
top of the spine.
so
Yeah.
Ravi, basically the points are replicated in our feet, in our hands, and on our face.
Even on the spine. Even on the
Oh,
spine. Yeah.
oh,
When you're moving on your spine, yeah, even when you're moving on your spine, you're actually touching upon every organ on your spine.
so now when I come to you, how do I know whether I need a foot reflexology or a hand reflexology or what do I need?
See, when you come to us, we firstly ask you, what is your problem? For what have you come? Then normally we identify to you that do this.
Hmm.
Maybe we become very authoritative and we feel we are the best. So we tell clients that this is what you need.
Hmm.
So we identify a therapy for them. This is how you go with it. And all of them, like we have 100% referral rate and 100% repeat rate of our clients. Like everybody comes
I'm
back.
sure, I'm sure.
Yeah. So we guide them that this is the way you do it. So something is something very specific or something, and they identify. Then we see which therapy is really good for them. So we guide them.
Okay.
Swedish and all is very good, but it's not one of my favorites.
Right.
I just feel it's
I'm more of a reflexology and deep tissue person.
yes, yeah, yeah.
I don't know whether that's what I need, but that's what I like. So now I'm
Yes,
coming to you to figure out what I need and when and how the sequence will
yes,
be.
yes.
And
And
so
you
we are
know,
all very safe during the pandemic, safe to come to your place.
yes, we sanitize our places. Every room is clean, sanitized, linen is changed. We wash the linen ourselves. We disinfect it. That we've been doing it from the very beginning. And of course, now in the pandemic time, we
Mm.
disinfect our beds, we disinfect the room, we disinfect everything before we
Mm.
and enter into our place.
Lovely. So we have this recording available on our Zaivic page where the link is given to you. We have it on our YouTube channel. Please look for Zaivic. We have a WhatsApp group called Fountain of Joy. You can join us there and you'll get all the updates. You can follow the page on Facebook, Zaivic India page. Again, you get all the updates there. So you have a lot of options, guys. So whatever you're comfortable with, please follow us and you will get to know what's next up here with us. And Ravneet's, Neelam, can you share Ravneet's number and contact details, please, on the chat and comments in the Facebook?
And before I end, Sheetal, can I show a 1 minute 23-second exercise, which is again one of my favorite, and it is
Absolutely.
very very helpful for people who are sitting on their computer screens and working from home for a long time. Yeah.
We would love it, please.
Yeah, sure. So what we do is you can, so like here, you can stand or the older age group can sit down also. So you're just joining your hands. You're keeping them here, your thymus gland, like just in a namaskara here. Your feet are on the floor with the 12 inches apart. See, when we do all that, we are more conscious about what we are doing. That's the idea behind it. So now here, just put your fingers, hands here in a namaskara. Bring it here, be there to a count of 5. Then bring them in the front slowly. Take your fingers apart, say, hands apart, say around 5 or 6 inches. Then in a big circle, like you just bring your hands at the back and you are joining the tips of your fingers over here. And bring them back again. You are just touching the fingers and press the fingers Interlace the fingers, press your thumbs. The thumbs represent the head region. Then bring your hand close to your chest. There's no stress in your body, it's very light. Then stretch your hands down, stretch your hands up. Take your arm along your ears, just above your head. Then turn to the left, come in the center, turn to the right, come in the center, be in the movement, come here. Take your hands behind your neck here, like it's just below at the knee of the neck. Then you join your elbows, just let them join. If they don't join, it's just perfectly fine. They will join in a few days. Do that, and then you spread your arms like an eagle nicely. Straight, be there again to a count of 5 or 6. You can actually just stretch your shoulders and your scapula and you feel very good. Take your hands up again, bring it down, and just shake. It's one.
So you circulated the whole
yes.
area.
So your upper, like your upper region of the body, you've done it. And I always suggest that do one round of this. You can do it 3-4 times a day.
Yeah,
people
you asked sitting down. Yeah.
So they can
Thank you, Ravneet. Thank you so much.
Most
so your spa is on Level Road, but you have Pro Reflex centers in which clubs right now?
We have it in Bangalore Club, in Century Club, and in the Karnataka Golf Association.
Okay, so that's KGA and Bangalore Club and Century Club.
KGA, we have both the salon and the spa.
Okay.
Bangalore Club and Century Club, we have the spas.
Okay. Lovely. We have Sejal who has said, what has she said? All what our grandparents used to do when they woke up. Yes. Yes, this is what we used to do. Thank you, Purva. She says it's such an amazing session. Thank you for sharing. Thank you so much, everyone. Any questions? Send it across to one of the links that we have shared with you, and we'll have Ravneet reply to that if there's anybody who missed a question. Thank you so much, Ravneet. Gratitude for sharing so generously. And yes, I will see you soon.
Thank you, Nandita, for having such a wonderful platform wherein all of us can share our skills and all our experiences. Thank you so much, Sheetal, for hosting me, and it was a lovely interactive session. I enjoyed every bit of it.
Thank you. I did too. So much to learn, so much to take away. And I will see you soon in person, sooner than you expect.
Please let me know. Give me the honor of.
Body is now like, it's like, okay, let's go. I will see you soon. Thank you, Ravneet.
Thank you so much. Thanks.
Yes, happy birthday, Ravneet.
Thank you.
It's your birthday, and what a great day to be doing this.
Yes, absolutely.
Wishing you super health and super success with all your endeavors.
Today, so I feel as young as ever.
You're looking and you're behaving as young as ever. You've got great flexibility. Amazing. Yeah. So all the best. Wishing you a super year and all the success.
Yes.
Wishing you on chat.
Yeah. Thank you so much, Sheetal.
Bye, Ravi. Thank you. Bye. Thank you, Neelam. Thank you, Nandita.